Hi, everyone, and welcome to this course in choosing a career in home health. I'm really excited to have you here with me and to talk a little bit about a career in our industry. It's an amazing place to work, and it's an amazing opportunity to really do a lot of good in the world. First of all, just a little bit about me. I have spent 23 years in home care. I've been an aide. I've been an accounts payable clerk, a payroll clerk, IT help desk staff. I've been an IT system administrator, a chart auditor, a chart room manager, a CFO, and a COO. And I'm currently the co-owner and COO of First Choice Home Health and Hospice. And I absolutely love this industry. It is a wonderful, wonderful place to work. And I'm so excited to have you here to learn a little bit more about it. First and foremost, I want to just talk a little bit about what is home care, because there's a lot of different versions of it. It can be a little bit of a confusing thing. A lot of times people think lawn and garden. That's absolutely not what we do. But more importantly, what are the types of home care? There's personal care, home health, and hospice, and then why it's an amazing career path for you. So first of all, what is home care? It includes any professional support services that allow a person to live safely in their home or in their residence. It can help somebody who is aging and needs assistance to live independently. It can manage chronic health issues. It can take care of somebody who's recovering from a medical setback. So they might have gone into the hospital and now they're returning, or they just have taken a downturn in their health. It may also help somebody who has special needs or has a disability. Home care can be provided for infants, for children, and adults, but the vast majority of home care is actually provided to the senior population. Historically, we've dealt with older people throughout the entire length of home care, and that is still the case today, although it has gone to a lot more younger people as of late. Professional caregivers like nurses, aides, and therapists provide short and long-term care in the home, and it really depends on the person's needs. Um, so there's three major types of home care. There's home health care, there's personal care, and there's hospice care. So home health care is short-term physician-directed care, and it's really designed to help a patient recover from an illness, injury, or hospital stay, or prevent that illness, injury, or hospital stay. Sometimes it's known as Medicare certified home care, sometimes intermittent skilled care, or visiting nurse services. Personal care is longer term, hourly care at home for people who have chronic illness, injury, or a disability. It's often been called private duty. Sometimes it's known also as home care, long-term care, catastrophic care, or non-medical home care. Finally, there's hospice, and hospice care is for people who have a life expectancy of less than 6 months to live, and it helps them to feel comfortable and get the most out of the end of their life. This is sometimes called end-of-life care or palliative care. So what is the difference between hospice, home health, and personal care? We talked a little bit about it just last slide, but I really want to dig a little bit more into that. First and foremost, home health. The focus of home health is really on rehabilitation after an accident or some kind of long-term disability. The care is always under the orders of a physician. This physician is not necessarily a member of the home health agency, so they're independent typically, and the agency and clinicians in the agency work with the physician to take care of this patient. There has to be a skilled need, so it can't be something that is just for non-skilled services. You have to have a need, so wound care or physical therapy, rehabilitation, something like that, to have them be eligible for home health care. Aides and are part of a larger care team of physical therapists, nurses, occupational therapists, speech therapists, and social workers. These services are primarily paid for by insurance companies, so Medicare, Medicaid, and private insurance. So there is also authorizations and other things that are dealt with as well that are a part of home health care. So what's personal care? Personal care can be used long-term as an alternative to going to an assisted living or care facility. It's not medically skilled care, so a nurse or therapist does not provide these skilled interventions under a personal care license. This is just strictly non-skilled care. They're mostly provided by caregivers and aides. You don't have to have a physician's order, so this is not something where you coordinate with a doctor. And services are primarily paid for either with long-term care insurance or out of pocket by the client or the client's family. Finally, hospice care is it's always under the orders of the physician. The physician has to attest that the patient has 6 months or less to live if their disease progresses as the physician expects. This physician oftentimes is employed by the home health agency, or excuse me, by the hospice agency. And hospice is a holistic care. So it's something that does not just take into account the physical needs of the patient, it's the physical, emotional, and spiritual needs of the patient. It also encompasses their medical equipment, their medications, and also their family and loved ones. There's home health aides, there's nurses, music therapists, chaplains, volunteers, alternative therapies like Reiki, pet therapy, and massage therapy. There's social workers that can be involved. And it's really paid for primarily by Medicare, although there are some health insurances that also pay for hospice. However, today we're really getting into home health care and how you can be involved in home health. So what does your day look like? So you'll go from place to place, taking care of people. These folks may be in one location, so it may just be in a congregate living area like an assisted living or senior living facility. It may also be their individual homes, and you'll go from place to place in a larger geographic area. You won't have necessarily a designated office that you go and check into every day and sit down and work. What you'll do is you'll have defined times when you can work with individual assigned patients. Your time can be flexible, so you can work with your agency to determine when your schedule fits with their schedule and with your patient's schedules, and craft something that works for you individually. So you know, if you need gaps because you're going to school to further your education, if you're trying to take care of family, friends, then you can do that, and you can organize your schedule in that way. At full time, you'll probably see about 6 patients per day. Sometimes it's a little bit more, a little bit less, depending on the acuity of the visits and how much need there is of the patient. So if you're doing something like diabetic visits, those are typically a little shorter, and therefore you may see a few more patients than that. So what do you do on the visit? Individual care in the patient's residence, and nurses can perform things like teaching about medications, health, the disease process. You can draw labs, wound care, lymphedema therapy, catheter care, ostomy care, IV maintenance, insulin checks and injections if the patient is diabetic. You'll do vital signs, you'll do wellness checks, and so much more. So really anything that you can do in a hospital where the equipment is not as necessary, that's something that you can do in the patient's home as well. Physical therapists, occupational therapists, and PTAs or CODAs can perform things like home safety assessments and modifications, exercise programs, gait training, transfer training, wound care, and lymphedema therapy. Therapy that improves the patient's ability to do activities of daily living. So this is things like bathing, dressing, cooking, and feeding. Adaptive equipment and assistive technology training, so you can help them to learn to use the equipment that they may need under their current or future level of function. Wheelchair and other assistive device training. So if they have had an accident and now they're going to be confined to a wheelchair, how to really use their wheelchair the most effectively. If they need to be in a wheelchair, moving them to a wheelchair, and then again teaching them how to use it most effectively. Speech language pathologists can perform things like speech, language communication therapy, memory and cognitive training, swallowing therapy, assistive technology training. And then social workers can work with the clients to assess their needs and really help them to access resources and services, can work with them for advocacy purposes, can listen to them, can counsel them, educate them, help them know what kinds of things there are in the community to better help them and to make their life as full as possible, and also help them with any transitions or needs that they may have. So, you know, we've got a few clinicians who have graciously agreed to chat with us and share a little bit about what they do on their visits. So here's one of them.
A time that someone made a difference in my life as one of my patients was when I took care of a patient who was a former Marine, and he had served in the Korean War. And as I got to take care of him and listen to his stories, I could see him for the man that he was and used to be. A lot of times we see the elderly as just who's right in front of us, and then it was really neat to see that he had been somebody different than who I saw. They're sometimes former soldiers, teachers, even former nurses, and they definitely have lots of lives, had dreams and lots of things to share with us.
So, what is home health really about? It's really about healing people and helping them be more independent. You are directing the care of your patients. You're the single most trusted source on how a patient is doing for doctors and for the fellow clinicians. You are the single source of truth. You play an absolutely critical part in making sure that these folks follow the doctor's orders so that they can return to independence. You're also checking on them regularly to make sure that they're not having any complications from their conditions. It's really trying to get them so that they are in their best position. And it's a wonderful and great opportunity to do some wonderful things in the world. What is it that some of these professionals love about their job? Because they love what they do. They have often come from hospitals or other care areas because they'd rather work here. And so, what is it that they love to do with their job?
I feel like in home health and hospice, I have made a difference and a contribution to the world and made it a better place in a lot of ways. Just giving the education, the love, and the care to people and preventing a lot of hospitalizations, a lot of infections, giving that education, teaching, and instruction to families. I really feel one patient at a time has made a huge difference in the world.
My favorite thing about home health, I would say, would be the relationships that I've built with my patients. They become my friends and people I honestly care about, and I seem to be the one that benefits from that in the end.
As a person working in home health, I've gained a better understanding of those who I work with. I've developed compassion and an ability to understand the things that they're saying, as well as watching what they're doing and provide an impact in their lives that makes a difference. It has truly been a blessing to work in home health and provide the necessary services for individuals to be able to improve their own lives and become independent once again in the community.
So, what challenges are there in home health and hospice? Because, of course, not everything is roses and sunshine. There can be challenges. The first thing is that the patients that you see may not be at their best. They can have serious health issues, and these health issues cause them pain and frustration. Especially with some of these more acute folks, and if they've got Alzheimer's or memory issues, that can be a real challenge for them. And so that can cause some frustration, and that can be hard for you as a clinician to deal with and to help them through. And even though they need it, it can be really, really hard for clinicians, or excuse me, for clients to accept your help. These patients have been independent most of their lives, and they now have to accept help. That can be really hard for anybody. And so that's one of the things that can be a real challenge and can lead them to be a little grumpy at times. Finally, you're going to get to know and love these people. And it can be really, really hard if you've had somebody on for a long time to see them either discharged because they had to go to another level of care, or because they were getting better and finally improved, or if they pass away. And that's something that can create a toll on you. At the same time, it is still a fantastic opportunity to really get to learn and know these people for who they are and for who they could be. So I have another one of our nurses who is going to share a little bit more about her thoughts on some of the challenges that you may see.
One of the least favorite things about the job of being a home health nurse would probably be when you have to say goodbye to your patients, whether it be when you discharge them and you've gotten to be really close with them, or one passes away.
So what is it that will make you successful? I've got one of our nurses who is going to share a little bit about what she feels will make you successful in doing this kind of work.
One of the things I wish I'd known about home health and hospice prior to beginning working in home health and hospice, learning the rules, regulations, protocols, knowing the why behind why we do what we do has been amazing. It helps with better outcomes in patients' health care, knowing the why we do what we do.
So what is the career path forward? What is it that home health can be? First of all, it is a great opportunity to show independence and decision-making skills. You are working far more independently than you would in a hospital or in a facility, or just working for a standard company where you go into an office. This is something where you are considered to be the single source of truth for your patients. And so as a result, you will be independent, you'll have decision-making skills, and you'll be able to make those decisions. It's a great way to hone and to develop those skills further. If you're, as a clinician, you can become an administrator, a director of nursing, or a therapy director. You can also go into other administrative functions. There's a lot of different opportunities in home health and hospice to grow and to improve and to jump around to greater and bigger things if you so desire. It's also a great way to be a springboard if you want to become a nurse practitioner or a PA. Those are both positions that we've had clinicians who have started as nurses and said, I want to go on and further my career. And they have used home health as a way to jump into being a nurse practitioner or jump into being a PA. And they've been very successful NPs and PAs as a result of that. It's also really flexible. So if you want to just work a little bit, if you feel like, I want to do this, but I don't have enough time to take a traditional hospital job or something like that, this is a way to get in to the healthcare industry, to work with your skills and to hone your skills while being able to maintain that flexibility. Here's one of the clinicians again telling you a little bit about her career path.
What I would tell someone if they're considering working in home health would be to go ahead and give it a try. It's very rewarding, and you can use your autonomy to be able to think for yourself within the doctor's orders, use your skills, and build relationships with people. Having been a nurse that came from the ER, I found that it was so much more rewarding to gain that relationship with my patients because I got to know them so much better and follow through with their care.
So how can you get started? First and foremost, talk with people who work in home health care. There's a whole lot of us out here, and we are really looking forward to meeting you, to helping you, and to growing with you. You can do ride-along visits or job shares with home health agencies. Most agencies are more than happy to accommodate that kind of thing and would love to have you come and learn more about it. There's also mentorship programs and volunteer opportunities. So we would love to have you volunteer with us. We'd love to have you come and learn a little bit more about us. And thank you so much for being here, for learning about it. And we really hope to see you here as a clinician in our industry very, very soon. Thank you so much.